Welcome to another Lyfelinez podcast. Yeah, that's what's going on. We've got a really special guest today, so we've thrown this on her a little bit. She was completely unexpecting it. We are filming some really interesting intro videos, all to do with the Hypo Kit. Those who've been following the brand will know a little bit about it, but today we're going to dig into a bit more. Donna, introduce yourself, I guess.
Hi. My name's Donna Sutton, and I am a diabetes specialist nurse.
Yep.
Working in the Northeast, but
Travelled a long way today.
Yes. So thank you for having me, but also happy to be supporting the Hypo Kit as well.
Yeah, so I guess before we get into any of this, the real interesting thing I think is tell people a bit more about your background. We just had a bit of a chat off camera about how long you've been in the industry, what you've done. Would I be right? And I don't want to put words into my mouth. You're a specialist lead in the space, aren't you?
Yeah, so I've got two roles. So I work as a lead community diabetes specialist nurse for Newcastle, and also as the clinical lead for Spirit Health for diabetes education. But I've been a nurse for nearly 20 years now, starting off in vascular surgery. So that's where my love and interest for diabetes came about.
Yep.
A lot of patients in a vascular setting come in, have diabetes. So approximately about 50% of my patients had diabetes.
Really?
So that prompted me to explore helping people with diabetes.
And the vascular piece, I'm going to look like I know what I'm on about now, but I don't, because I went to a dinner, an event last night. But the vascular piece, I guess, for those that are unclear, is if I guess you're in the department, is the issues that diabetes creates with the restriction of blood flow in the veins. So that's probably where the correlation to do with you, probably a high percentage of the patients you had diabetes, right?
Yeah, so there's two things that can happen is the high levels of sugars can, as you said, restrict that blood flow, but also it can damage nerves. And, nerves you've got all over your body, but that can become apparent in your feet, so leading to something called neuropathy. So that's when you can't feel anything.
Know all about that now.
So stories of people putting their feet into shoes and bits of Lego and they're not feeling it.
Kids' toys. Yeah, I heard about that last night. It's shocking. Yeah. But then it's also the damage that it can do, like putting people in hot baths.
Yeah.
Burns.
Yeah, so if you can't feel how hot the bath is, or, even when we do get our summer and you step outside onto your patio and it's really hot on bare feet, then you wouldn't be able to feel how hot that was, and you can also get burns to your feet. That
explains. I was in and out of listening last night. My attention span's not great, but they were talking about going on holiday.
Yeah.
Hot sand, and that kind of rings a bell what they were talking about. So Spirit Health, do you want to tell everyone a little bit about what Spirit Health does? It'll be an education for me as well, because I'm not completely up to date with it.
So Spirit Health, I work in the Empower section of Spirit Health, which is empowering people with type 2 diabetes to live a fulfilling life without or minimising their complications of diabetes.
Yep.
So we deliver the Empower session, which is aimed at people that are newly diagnosed with type 2 diabetes. And that's, we're kind of delivering that across the UK and hopefully further beyond as well.
And so your bit of it in Newcastle, I guess, then. If this is a national programme,
Yeah, so I'm, as I said, based up in Newcastle, so we deliver that right up to Berwick. So
it's a long way.
Yeah.
just south of the border, that, isn't it, from memory?
All the way down to Kent. So,
oh, wow.
Yeah.
Okay. And how many of you are there then?
There's 10 of us.
Okay.
Approximately.
So there's 10 educators within the...
Yeah.
And you cover that nationally. So is a lot of that virtual?
It's about 50-50, so we can deliver face-to-face in group settings, but also we use Teams to do virtually as well.
Great tool. So we'll put a little link up to Spirit Health just to help everyone educate or give them something to follow. But I guess digging into probably the reasons how we've met and why we're here. So Kate Walker, people might have heard a little bit about her before. We met in the most random setting as well, and we'll probably go on to this. I think she's going on the podcast after. She used to be a physio. I want to say she's a physio. She's behind the camera now. Physio, no? When you first did, you fixed my sports massage. Physio sounds a bit better. We'll go physio. So I was selling health and safety in Birmingham, and I had a bad shoulder, and then 15, 16 years on, she's now got a really vested interest in this topic of diabetes, genuinely from a place of trying to improve it in the workplace. I don't think the awareness and education is quite rightly there, which is exactly why you and I are sitting over a table in Shrewsbury, and you've drove all the way from nearly in Scotland in an electric car, and we're talking about the Hypo Kit. So it was an idea that we come up with around, well, I can't get it because it's hidden away, but the current tool I think that is around seems inappropriate, I would guess. It's big, it's clunky, seems expensive, there's a lot of things going in there. And whilst this kit is designed to support awareness, so those at home, we'll try and get the camera zoomed in, it's a QR code. Donna's come down today to help video the intro to this. So this in its entirety would sit in a workplace next to a first aid kit, a defibrillator, with the view that through the QR code, an employer's making an attempt to help educate the workforce by any staff member can scan this. You get to hear back from Kate, hear from Donna around some of the specifics of what this does, do a little education course, you get a certificate, and then this means that there's an emergency response tool, for want of a better phrase, that sits in the workplace that can help deal with something called a hypo. Now, I'm not even going to begin to tell you about that. I'm going to ask Donna to talk us about what a hypo is. But essentially, we've got 3 glucose shots inside. Now, the interesting thing is hypos can kill, and the Lyfelinez brand has got quite an apt name. So I guess I'm going to hand over to you, Donna, to talk about probably your thoughts, feelings on the kit, and then tell us a bit about what a hypo is for those that don't know.
Yeah, I'm really excited about this because, having that in a workplace as a kit to help people that have got diabetes when their glucose levels are dropping low, to help them. Because as you say, hypos left untreated can kill. And prolonged hypoglycaemia can cause long-term damage to their brain and memory function as well. So it's important that people are recognising and treating hypos really quickly, and that's why Lyfelinez is great, because it's going to increase their glucose levels really quickly. So hypoglycaemia is when someone with diabetes glucose level drops below a certain level. Right. Our bodies, for people that don't have diabetes, are able to maintain that level through our own glucose that our bodies produce. Yeah,
and we use insulin to counterbalance and all that.
Yeah,
believe, right?
Insulin and glucagon kind of work together so that we keep our glucose levels within a certain parameter. Yep. Someone with diabetes, though, whether that be type 1 or type 2 diabetes, especially when they're treated with insulin and certain medication, their glucose levels, that sort of numbs that response of the glucagon so that they can't bring their glucose levels up independently. So they need to be aware that when their glucose levels drop, they potentially will get symptoms. Majority of people do, some people don't.
And they may look like?
Well, they may, to me and you, they may go a bit pale. They may start sweating or look like they're trembling. They may start acting a bit strange.
A bit delirious?
Yeah, they may look like they became drunk, slurring their words, stumbling around, things like that. So it's important to recognise if your workmate, your buddy
is a bit off.
It's starting to look a little bit not right.
Yeah.
Check in with them, because they may need to be increasing their glucose level.
And it could be this. So from what I believe as well, if we kind of leave them where they are, they'll just slip into a bit of a sleep and essentially up in a coma, right? And then can end up dying, is it?
Yeah. So if your brain needs that constant supply of glucose to keep it functioning, and your brain's telling all your organs what it needs to do, and if it's not got the juice in there, the glucose there to keep it functioning, then it's just going to. It's a bit like a desktop computer. If you unplug that, it's not going to work. We're not laptops. We can't go without our constant supply of glucose. So
fine. Yes. So I mean, we'll put a little bit more up in this in the post. I guess. Do you want to share some experiences? We were talking about some things. What's some of the things you've done through your time working? I mean, I'm guessing you've been on in a doctor's surgery. What would be the right description of the settings you've worked? Because we watched some things last night, right? We went to this conference and we seen some feet pictures. There was someone described an ulcer that didn't look very bad, and if I had that on my foot, I'd probably been a right mess. And then it showed after they dug out the bottom of the foot, and basically half the foot was missing, but it was salvaged and stuff. So I guess we've talked off camera, this is some of the stuff that you've done before, right?
Yeah, absolutely. So in my time working on the vascular ward, I've seen a lot of foot injuries or caused by ulcers, or even, as we were saying about stepping on Lego and things, the damage that can cause. But diabetes, and we mentioned that earlier as well, about how it's something that people don't feel symptoms. They feel well with diabetes, but unfortunately inside them, can be causing damage with the high sugar levels. So through my experience, I've worked in patients, so seen people from coming into A&E really unwell with the diabetes, in ITU through really high sugar levels or really low sugar levels, cause of strokes as well. So, I've seen quite a lot of really difficult cases on the wards. And then, working in community settings and GP practices, people with diabetes are everywhere. Those numbers, and Kate's the statistician, she'll have the numbers for us all. But yeah, we're 5 million people, we're almost there in the UK have diabetes. So we come across some staggering. A lot of settings.
So I'm going to churn a few out because I'm always 700 a day.
Yeah,
we've got that. I mean, we're making live here through just how we've heard it, but I think, and it's probably the things I think as an owner of a wellness brand, and we've talked about this, I know it's about promoting movement, functional mobility. I've trained an awful lot in my life, but I'm certainly now turned 40. It's about, do I want to get big anymore? Probably not. Do I just want to keep going as long as I can? Yes. Is that linked to flexibility? Yes. But 700 people a day. It's hard to put into or to imagine that. I mean, we sat when we were based in Shrewsbury right now, so the conference last night we were at suggested there's 30,000 people in Shrewsbury alone that have got type 2, 3,500 with type 1. There's only 70,000 people that live here. I mean, that's just a staggering amount. And a lot of this, since sitting in the room, is behavioural driven. We've talked about this. Everyone that knows me, I've got some quite strong views about physical activity and then discipline. But jokes aside, this is quite holistic, right, from what I think we've spoke about, and it's lifestyle driven over extended periods of time. So throwaway comments like mine about, just go carnivore and stuff are meant in jest. But I do believe it's an extremely large problem to fix. So if you could do 3 things to help fix this, what would they be? What would you be advising people? In fact, what do you do day to day?
So my strong belief is that we need to change the culture from early ages.
Agreed.
From, getting into primary schools, letting them understand, age-related, what is diabetes. I think we see a lot of it in the media portrayed as people that are extremely overweight. But, someone that even their BMI could be 26, 27, just a little bit over, and that can trigger that response for the diabetes. It's worth saying, though, as well, people with type 1 diabetes, it's not something that we can prevent.
No, that's medical, right?
Yeah, so that's autoimmune disease. So there's nothing we can do to detect or prevent that from happening.
And that can happen at any time in your life, right?
Any time, right up into, retirement ages as well. So I think it's approximately about 50% of people that are diagnosed with type 1 diabetes are over the age of 25. Because I think a lot of people think of type 1 diabetes as mostly diagnosed.
I'm going to add an anecdote here. So we were at an event last year in the Ministry of Sound. It was a fitness event, not a rave. And a young lady just under 30, she's an investment banker, only recently, in amazing shape. Gaz remembers, immaculate shape. Then turns out she was an Olympic level swimmer, diagnosed with type 1 like 12 months before, completely ruined, like Olympic career over. It was quite a ground moment. I've gone, well, looking at this 6 foot tall woman that's in an immaculate condition, thinking, wow, she's trapped out by her, or certainly impaired by, what would you call it? I don't know what to call it. It's not a disease. It's not
condition.
A condition. Yeah, I want to be particular about the words I use here.
Yeah.
So, a condition that's so debilitating. So, and I guess for those that don't know what type 1 is, it's a consistent management of trying to. Or is this a good? You can tell me whether this is a good assumption of trying to manage your output. So, understanding if you're going to go and do exercise, then you need to require to take on a certain level of insulin. Is that a fair description?
Type 1 diabetes is when the beta cells in the pancreas stop producing their own insulin.
I should just let you do this.
So people with type 1 diabetes have to inject insulin to be able to survive. And so they need to manage their levels of insulin depending on what they're eating, so carbohydrates, fats and proteins.
Yeah.
But with activity or exercise...
Like preempting it, right?
Yeah, so I think someone said someone with diabetes has to make more than 100 more decisions a day than someone that doesn't have diabetes.
And that's what she was talking about. And it was like, you just start to think, like everything you have to do, the input of food, the output of exercise. We've got a few motocross riders. I think Josh, quite a few of the guys that have ride, they found my Hydro G product because it's minimal calories, but got a lot of cool ingredients, vitamins, minerals, and some things that complement the body's ATP process, which are all fairly naturally occurring. So we've got our own diabetic community in the sports settings that have already got an affinity to the brand anyway. But type 1, it changed my opinion on the diabetic word, or the word diabetes, which I had probably a fairly dim view of from a lack of knowledge. So, but type 2, that's the more common one, right?
Yeah, that's the one. Over 80% of people with diabetes are going to be diagnosed with type 2 diabetes, and this is something that potentially we can prevent or slow down the chance of it happening in life. So a lot of it is associated with our lifestyle, what we're eating, what we're doing. So making sure, as I say, children are aware, because we learn from our parents.
We do.
So trying to change and stop that cycle of
what would you so think I'm a parent now, what would you be saying? Dave, look, you've got your little 5-year-old. What would be a couple of things you'd be suggesting to do, or what would the education in school look like, headline stuff?
So looking at how we fit activity into life and how that affects our life. It's not just about being fit, it's about keeping ourselves healthy. It's not only promoting, prevention of diabetes, but, that heart health and joints. And so, the importance of keeping well, I think that's really important. And I think that should be, I know schools are trying to get more PE subjects in and making children move more, but I do think that a stronger emphasis needs to be put onto that. Yeah,
and I think for me, I've got a real passion for all things health and wellness. I'm going to use that now as well, because I don't like the word fitness. I think it can alienate people. But as to the why, not just like the well-being element that it makes you feel. It's like, well, this will help with blood flow. This will help. I mean, people who sweat more. Kate, we found this out last night, which I'm pretty pleased. I sweat loads. People who sweat more are apparently fitter. I think the word's healthier, but I'm going to use fitter because your sweat glands, right? Isn't it? They become more active. Because I think last night a topic of conversation was nerves in the feet, or sweat glands in the feet stop working. Just in line with, obviously, there can be a blockage somewhere higher up the leg in a vein, or an artery rather, that's feeding the legs through the diabetic condition that then stops just a lot of, or kills off that limb, I guess. Mm-hmm. So that was one interesting one. Sweaters. So if you're a top sweater, you're probably really fit. I'm a top sweater. This is going to be like to think of what. She'll agree though. So look, I think we threw this on you, so I'll say thank you for jumping on. And I hopefully see. So whilst we're doing a lot with the Hypo Kit, the idea of the podcast is to try and share knowledge around topics that have an influence on health and wellness, and probably lean into some of the hard conversations. I'm definitely probably not someone that needs to help tackle the problem front facing, as we probably, as you discussed sooner, but I certainly will do. And I think with what the work we're doing with the DSO, and we'll speak to Kate shortly, and then hopefully if there's anything you can think of we can do together or share this, because I think it's a real knowledge share. I do a lot of work with the education community in the local area as it is. I've volunteered to be business advisor at a secondary school, and I think some of these I've already had ideas of, like, trying to understand, is there any external programs that we can kind of introduce. So do shout up. Other than that, have you got anything else you want to share before we grab a coffee, before you've got to then jump in front of a teleprompter?
I think the only thing I'd like to say is watch out for the signs. If you've not got diabetes already, watch out for the signs that you could be developing diabetes. So if you do notice that you're becoming more tired, or if you're peeing more, especially during night, or if you're becoming more thirsty, those are the main sort of signs of hyperglycemia, which is high sugars. It's worth going to your GP and getting that checked out.
I know what we're going to do. We're going to blend here with your video, because I've seen an early attempt here, mate. So that's brilliant. So we'll put some information up. Beautiful Figure Out podcast. We can throw things in over the top. But look, thank you for jumping on. Hopefully it's not been too painful. I've quite enjoyed it.
It's been fun. Thank you very much.
Thank you. Cheers.